Okay, please take a seat. We've got time for a couple of questions from the audience. So raise your hand or shake your card, or please, Marcus.
Good afternoon. Congratulations on both your talk. I think the spirit of research it's something that make us think to go forward and move forward and so on. I think thinking about syndemics is good because it will help us to find better ways to integrate and find synergies. But I want to offer, it's a comment more than a question, and also a question, but I want to offer a word of caution. Simplicity is important. Because in many of our countries, low and middle income countries, we don't have all resources available. So simple measures, and there are experiences, and probably you know, in Africa and in Latin America, I agree community engagement is very important because there is no first level of care in many communities. But it's important that, to me, key issue on this, and I have a little bit of problem understanding your graphs, Tolu, because they were kind of heavy, so we need more time. But to me, simple measures that are available at the first level of care or at the community center where the leaders are there could really help, like, you know, blood pressure undertaking, like availability to measure glucose. Because one of the problems we're facing is that the lack of governments taking this integration forward. If you look at diabetes and TB, in 2011, almost 10 years ago, the International Union Against TB and Lung Diseases and WHO published what is called the Collaborative Framework to Address and Manage TB and Diabetes. And we keep hearing and seeing good practices at local level, small pilot projects, but is it that the health workers are really tired? Is it part of the culture that my territory, I don't want it to bring NCDs into my territory of infectious diseases? Because the lessons learned from the HIV epidemics and integrating HIV and TB, which is happening in many areas in Africa, are really, really telling. But how can we make sure, because it's about people, health workers do their part, and those simple measures are available in the community? Because if we get too complex, then we might not be taking those approaches.
Well, maybe you can both take a shot at that, and then we'll move on. Not easy.
It's not, yeah.
Thank you for that comment. I actually took out a slide that I had that was titled Simplicity and Complexity, right, because I think there's a difference between complexity and complicated, and sometimes we confuse the two. I think simplicity is vital in how we affect things, but that does not necessarily mean to be overly reductive, because if we're actually going to be effective in the long term, we have to embrace that complexity, and there's a whole range of complexity science that can help make this a lot simpler. Bearing in mind that, I mean, the examples you gave are again around healthcare in terms of how, in the context of high risk or already diagnosed, the same thing can be, and I'm going to be that bugbear for the next day and a half every time we just talk about care, that we keep coming back to care, and in the context of how do we, especially in the context of low resource settings, who is thinking long term to make sure, because we're not going to be able to catch up to that demand. There's no economic growth that will catch up to the need for how much treatment that will need to happen. So how can we think in the long term about that primary prevention, about young people who don't already are at high risk? Why are we waiting to, if we oversimplify, for example, without embracing complexity, then we just do we entirely focus on screening? But that does nothing for the TAP. We're pulling in the load, the risk is still coming through. Soon we won't be able to cope with the amount of screening that is needed. We can't afford that. So my response to you is absolutely simplicity, but simplicity within that complexity. And I think it's something we have to be brave to understand and work out how to act so that we're not paralyzed by the complexity.
Yeah, I have a couple comments that I think are really relevant here, which are big comments, but thinking about three key things. Number one, inequality is driving this, so we can recognize that. So it's not necessarily global north, global south. It's wealthy in wealthy countries and poor in poor countries around the world, in wealthy and poor countries alike. And that's what we're seeing as really extraordinary divides among health outcomes. For example, South Africa, a wealthy nation, relatively wealthy nation, has health indicators of a low-income nation because, in part, of extraordinary inequality. So I think this is probably something we can all agree on. But another thing is really risk pooling and healthcare. So how do we finance health systems? That's a fundamental question. Universal health coverage is, one thing the WHO is leading. People are talking about how do we actually provide care for people who need it. Well, really providing care that can reach everyone who doesn't have care. That's a fundamental thing we can do. But within that, thinking about how it's organized. So it is actually cheaper to care for people instead of diseases. Because if you care for full people, humans, and not diseases, you can deal with the other conditions that are going to impede care on medication that's prioritized by WHO, by the Global Fund, by PEPFAR. If we actually care for people, it can make a profound difference. But that's a larger conversation about how we train people, where we put money, where we put political power, what we prioritize, and what we think is just and right. And that's a bigger conversation. But I think that gets to the heart of that. And another thing is enabling people. As an anthropologist, I have to say this, but enabling patients to feel heard and cared for. Being able to go to the clinic and feel that they were actually taken seriously, which is a huge problem that is well documented. It may even include a touch on the shoulder. But in many cases, people go and they get medications, but they're never cared for. And that's a fundamental problem around the world that needs to be addressed, which is also cost-free.
Okay. So we've heard the complexity of the challenge. We're going to bravely embrace it for the next day and a half. And you're going to guide us in that and keep us real as we go through this. So thank you very much, Solomon and